Welcome to Pediatric Case Review. Today we'll be discussing Henoch Schönlein Purpura, the most common vasculitis affecting children. This lecture provides a comprehensive review for practicing pediatricians managing this condition in clinical settings. A 5-year-old presents with palpable purpura. Which statement about Henoch Schönlein Purpura epidemiology is correct? A. Most common in adolescents 13 to 18 years. B. Affects males and females equally. C. Peak incidence is 4 to 7 years of age. D. Primarily occurs in summer months. The correct answer is C. Henoch Schönlein Purpura has a peak incidence in children aged 4 to 7 years. It shows male predominance with a ratio of approximately 1.5 to 1. The annual incidence is 10 to 20 cases per 100,000 children, and it occurs more frequently during fall and winter months. What is the primary pathophysiologic mechanism in Henoch Schönlein Purpura? A. Immunoglobulin G-mediated thrombocytopenia. B. Immunoglobulin A immune complex deposition in small vessels. C. T-cell mediated destruction of vascular endothelium. D. Autoantibodies against basement membrane. The correct answer is B. Henoch Schönlein Purpura is characterized by immunoglobulin A immune complex deposition in small vessels. It's a leukocytoclastic vasculitis affecting small vessels with abnormal glycosylation of immunoglobulin A1. This process is often triggered by preceding upper respiratory infections or certain medications. A 6-year-old boy presents with a 2-day history of rash on lower extremities, abdominal pain, and joint pain. Which feature is least likely in Henoch Schönlein Purpura? A. Fever above 39 degrees Celsius. B. Palpable purpura. C. Colicky abdominal pain. D. Ankle and knee arthralgia. The correct answer is A. While low-grade fever may occur in Henoch Schönlein Purpura, high fever above 39 degrees Celsius is uncommon. The classic tetrad includes palpable purpura, arthralgia, abdominal pain, and renal involvement. The purpura typically appears on dependent or pressure areas like the lower extremities and buttocks. Which skin finding best characterizes the rash in Henoch Schönlein Purpura? A. Malar rash sparing the nasolabial folds. B. Palpable purpura predominantly on lower extremities. C. Erythema marginatum on the trunk. D. Target lesions on palms and soles. The correct answer is B. The hallmark of Henoch Schönlein Purpura is palpable purpura predominantly distributed on the lower extremities in a symmetric pattern. The lesions may initially appear urticarial before becoming purpuric. In young children, the rash often involves the buttocks and lower back due to gravitational dependency. An 8-year-old with Henoch Schönlein Purpura presents with joint pain. Which joint finding is most typical? A. Symmetric polyarthritis of small joints. B. Transient migratory arthralgia or arthritis of large joints. C. Fixed erosive arthritis of knee joints. D. Sacroiliitis with morning stiffness. The correct answer is B. Joint involvement in Henoch Schönlein Purpura typically presents as transient migratory arthralgia or arthritis affecting large joints. This occurs in 60 to 84% of children with HSP. The knees and ankles are most commonly affected. The arthritis is non-destructive and typically resolves without permanent damage. A 7-year-old with Henoch Schönlein Purpura has severe abdominal pain. Which examination finding is most concerning? A. Diffuse tenderness without guarding. B. Occult blood in stool. C. Periumbilical purpura. D. Abdominal distension with absent bowel sounds. The correct answer is D. Abdominal distension with absent bowel sounds is most concerning as it suggests serious complications like intussusception or bowel perforation requiring urgent intervention. While abdominal pain affects 50 to 75% of patients with Henoch Schönlein Purpura, signs of peritonitis warrant immediate surgical evaluation. Which laboratory finding is most consistent with uncomplicated Henoch Schönlein Purpura? A. Thrombocytopenia. B. Normal urinalysis. C. Elevated antistreptolysin O titer. D. Decreased C3 and C4 complement levels. The correct answer is B. In uncomplicated Henoch Schönlein Purpura, urinalysis is often normal initially. The platelet count is typically normal or elevated, distinguishing it from thrombocytopenic purpuras. Complement levels are usually normal, unlike in hypocomplementemic vasculitis. While streptococcal infection can trigger HSP, an elevated ASO titer is not specific. According to the Euler/Printo/Prez criteria for Henoch Schönlein Purpura, which finding is mandatory for diagnosis? A. Immunoglobulin A deposition on skin biopsy. B. Palpable purpura without thrombocytopenia. C. Arthritis in any joint. D. Hematuria and or proteinuria. The correct answer is B. According to Euler/Printo/Prez criteria, palpable purpura without thrombocytopenia is the mandatory criterion for Henoch Schönlein Purpura diagnosis. This should be accompanied by at least one of the following: diffuse abdominal pain, arthritis or arthralgia, renal involvement, or immunoglobulin A deposition on biopsy. The diagnosis is primarily clinical. A 5-year-old with Henoch Schönlein Purpura has mild joint pain and typical rash. What is the most appropriate initial management? A. Oral prednisone for 2 weeks. B. Supportive care and nonsteroidal anti-inflammatory drugs for pain. C. Intravenous methylprednisolone pulse therapy. D. Oral cyclophosphamide. The correct answer is B. Uncomplicated Henoch Schönlein Purpura with mild symptoms is best managed with supportive care and nonsteroidal anti-inflammatory drugs for pain relief. Most cases resolve spontaneously within 4 to 6 weeks. However, NSAIDs should be avoided if gastrointestinal symptoms or renal involvement are present. Regular monitoring for complications is essential. A child with Henoch Schönlein Purpura develops nephrotic range proteinuria. Which treatment is most appropriate? A. Observation only. B. Angiotensin-converting enzyme inhibitors alone. C. Corticosteroids with or without immunosuppressants. D. Plasmapheresis as first-line therapy. The correct answer is C. Significant renal involvement in Henoch Schönlein Purpura, such as nephrotic range proteinuria, requires aggressive management with corticosteroids and possibly immunosuppressants. Early intervention may prevent progression to chronic kidney disease. Angiotensin-converting enzyme inhibitors are useful as adjunctive therapy to reduce proteinuria. In severe cases, cyclophosphamide, azathioprine, or mycophenolate mofetil may be considered. A 4-year-old with Henoch Schönlein Purpura presents with severe abdominal pain, bilious vomiting, and bloody stool. What is the most likely complication? A. Gastric ulceration. B. Intussusception. C. Pancreatitis. D. Appendicitis. The correct answer is B. Intussusception is the most likely complication in this scenario, occurring in 2 to 3% of children with Henoch Schönlein Purpura. The classic triad includes colicky abdominal pain, vomiting, and bloody stool. This complication requires prompt surgical consultation and possible intervention. Other gastrointestinal complications include perforation, hemorrhage, and rarely pancreatitis. Which factor is associated with the highest risk of long-term renal complications in Henoch Schönlein Purpura? A. Female gender. B. Age less than 5 years at onset. C. Persistent proteinuria greater than 3 months. D. Initial presentation with arthritis. The correct answer is C. Persistent proteinuria lasting more than 3 months is the strongest predictor of long-term renal complications in Henoch Schönlein Purpura. The long-term renal prognosis primarily depends on the severity of the initial nephritis. Approximately 1 to 2% of patients progress to end-stage renal disease. This highlights the importance of long-term follow-up of renal function in these patients. A 6-year-old presents with palpable purpura, normal platelets, and arthralgia. Which finding would suggest a diagnosis other than Henoch Schönlein Purpura? A. Recent upper respiratory infection. B. Positive antinuclear antibody and decreased complement levels. C. Involvement of buttocks and lower extremities. D. Microscopic hematuria. The correct answer is B. Positive antinuclear antibody and decreased complement levels suggest lupus vasculitis rather than Henoch Schönlein Purpura. Key differential diagnoses include other vasculitides, sepsis with purpura, thrombotic disorders, and even child abuse. In HSP, skin biopsy typically shows leukocytoclastic vasculitis with immunoglobulin A deposits, which is diagnostic when clinical presentation is unclear. What is the approximate recurrence rate of Henoch Schönlein Purpura within 6 months of initial episode? A. Less than 5%. B. 10 to 40%. C. 50 to 75%. D. Greater than 80%. The correct answer is B. Henoch Schönlein Purpura has a recurrence rate of approximately 10 to 40% within 6 months of the initial episode. Recurrences are typically milder than the initial presentation and become less frequent over time. The long-term prognosis is excellent in the absence of severe nephritis, with only 1 to 5% of patients developing chronic kidney disease. Henoch Schönlein Purpura in adolescents compared to younger children is associated with A. Lower risk of renal involvement. B. Higher likelihood of complete recovery. C. Greater risk of severe renal disease. D. Less frequent recurrences. The correct answer is C. Adolescents with Henoch Schönlein Purpura have a greater risk of developing severe renal disease compared to younger children. This includes a higher incidence of nephritis and more severe long-term renal outcomes. The purpura may also be more extensive in older children. These age-related differences highlight the importance of early recognition and careful monitoring in adolescents with HSP. Thank you for joining our comprehensive review of Henoch Schönlein Purpura in pediatrics. Remember that while HSP is usually self-limiting, careful monitoring for complications, especially renal involvement, is essential as it determines long-term prognosis. Please follow our pediatric case review channel for more educational content and leave your questions in the comments section below. We appreciate your attention and look forward to seeing you in our next presentation.